Hi, my name's Roger. I'm Jenna's OT.
Hi, I'm Kiley. Nice to meet you.
It's good, nice to meet you. I've heard so many wonderful things about you. So Jenna has been an amazing patient here at the inpatient rehab, and so she's getting ready to discharge, and I just wanted to show you how to wheel her up and down the curb.
Okay.
You okay with that, Jenna?
Yeah, of course.
And then, so are you experiencing any pain right now?
Just a little soreness in my hip.
Yeah.
Very
Okay, so in your hip, how would you rate your pain from on a scale from 1 to 10?
Oh, I'd say probably about 4.
Okay.
Yeah, not too bad.
Not too bad. And is there any other pain in your body other than the pain in your hip? No? Okay, cool. Alright, so if you do have increased pain, please let your doctor know. So I'm going to show your caregiver how to wheel you up and down a curb. Okay, so the very first thing is that we're going to have a firm grasp on the handles, at least with one hand always. So I'm going to grab it with one hand and then lock the brake. And then I'm going to switch hands and then lock the other brake. Cool. And then so now we're going to push Jenna all the way up to the curb. Alright, cool. Alright. Don't worry, Jenna, I got you.
Okay.
Alright, so now we're going to tilt her wheelchair backwards. And so we're going to go ahead and just gently tilt her wheelchair backwards. I'm going to have my knee and my thigh and her upper and lower back. And I'm going to gently just tilt her backwards like so. And then it's better to stay a little bit lower to the ground so that way you have more leverage when you're wheeling her in this position. And so I'm going to gently just go forward with little steps until the big wheels hit the curb. Once the big wheels hit the curb, and I could feel it a little bit, I'm going to go ahead and put my dominant foot between the two wheels. And then I'm going to gently push my dominant thigh to her back as I gently lower her down. And that's it. And then I'm going to now gently lower the front two wheels until they touch the ground. And that's how you will lower Jenna down. You good, Jenna?
I am. That was very smooth.
Okay, cool. So like if you feel any pain at any time, just let us know. Cool. And then so now, in order to get Jenna back on the curve, I'm going to tilt you back again, Jenna. So we're going to get upright to the curve till you see her feet almost at the curb. And then now, same thing as before. I'm going to put my knee and my thigh on her back and gently tilt backwards. And then I'm going to tilt her backwards and have a little bit lower body stance. And now I'm going to go forward, small steps, until I feel the big wheels hit the curb. Once the wheels hit the curb, I just go ahead and gently lower the front two wheels. Once those two wheels are down, I'm going to get my dominant foot, put it between the two wheels, and gently push with my thigh and my knee until she's on top of the curb.
Okay.
Yeah. And did you want to try it? Yeah, don't worry. Are you feeling good, Jenna? Okay, cool.
So I'm going to first tilt her back and then
Good.
Is that good?
Yeah, how did that feel, Jenna?
That was good. Great job.
Good job.
Okay, so going back up, Grandma, I'm gonna tilt you back a little bit, and then we're gonna go until the big wheels reach the curb, and then I'm gonna tilt you down, and then use my knee to guide you up.
Perfect.
How was that?
I don't know, how was that, Jenna?
That felt good. I feel confident with my caregiver.
That's good. A happy client slash patient is a good client slash patient.
Yep.
All right, so I just wanted to remind you of your hip precautions since you just had hip surgery. So I have them written here, printed out, but here they go. But
Thank you.
um, as your caretakers have been telling you, no bending your more than 90 degrees. So this is your upper body, this is your lower body. Make sure not to make a 90-degree angle or anything smaller than that. So you always want your upper body a little bit further back than your lower body. So with that in mind, I would recommend a bedside commode that's a little bit elevated, so that way you're not placed in a 90-degree angle or just shorter than a 90-degree angle. Also, we have this device, it's called the grabber, and then so this grabber here is to help you grab stuff if it's lower than knee height. Yes, so just like that. And then, good. And then I've gone ahead and fastened it to your wheelchair, so that way you can just Velcro it on there and grab anything. So if you see if anything that's below knee height, do not bend over to grab it. Use the grabber to pick something up. That being said, back at home, I would recommend that anything that's below knee height be placed on higher shelving. And yeah, so those are the main things that with hip precautions that you should watch out for. Yeah. And then how are you feeling?
I'm feeling good. I feel a lot better just going home now.
Yeah. So how's that pain level? Is it out of 4 or?
Yeah, it's still sore. I guess that's expected.
Okay, cool. And then it was an awesome job, Kiley. And also, I just want to let you know that we have hips surgery support group. It meets every Fridays here on site, and they provide free lunch and snacks. And so it's a bunch of patients who choose to show up if they want to, and talk about what it's like dealing with precautions after hip surgery. There's an OT that leads the meeting. So if you have any questions about doing ADLs and the safetiness in it, just let them know and they will be there. But let us know, let your physician know. We'll be more than happy